Hi, my name is Dr. Saif Gallagher. I'm a plastic and reconstructive surgeon here in Miami, and I specialize in gender affirmation surgery. Today, we're going to talk about scrotoplasty for trans feminine patients who are interested in this procedure. Now, one thing about gender affirmation surgery I always say is patients have to be very familiar with all the different options, because it's certainly not one size fits all, and indeed many patients will never want or need surgery as part of their transition. However, it is important to know all the different things that are available so that a patient can make an informed decision. So for bottom surgery for trans feminine patients, the one usually folks think about is full vaginoplasty, and there's a few different techniques for doing that. However, that's certainly not for all patients, and many patients will do fine with just like I said, no surgery, but there's a group of patients who will do fine with just orchiectomy or removal of the testicles. Scrotoplasty can be added in very easily at the time of this procedure. And what scrotoplasty means is when we're removing the testicles, we also remove the scrotal tissue down there to make the area smoother. There's a few different reasons patients will opt to do this. They may prefer that look. It makes tucking easier, and they don't want the extra skin down there. Typically, a scrotoplasty and orchiectomy is an outpatient procedure. It usually takes about an hour to do under general anesthetic, typically is how I do it. And the patient goes home the same day after surgery, usually with a downtime of about a week. When we do the orchiectomy, usually we place a small incision, just about an inch long, in the central part of the scrotum. And when we do the scrotoplasty, the incision is longer depending on how much skin we remove. And the patient obviously gets a say in that, but we can remove the scrotal skin at the same time. Typically, I recommend that if bottom surgery or vaginoplasty is in your future, you want to preserve as much of the tissue down there as possible. So usually scrotoplasty isn't a great option. There are new ways of lining the new vagina, which we do more commonly now, such as a peritoneal vaginoplasty. So that fact isn't as important as before, but usually I encourage patients to leave the raw materials there in case we need them in the future, if vaginoplasty with depth is in the future. But it's very important to know that this procedure is available, and we can add in the scrotoplasty at the same time as the orchiectomy or removal of the testicles.